أهلا وسهلا فيكم بحلقة جديدة مع The Pain Podcast جواب لكل وجع. اليوم حلقتنا حتكون بالإنجليزي، معنا شخص كتير مميز. رح كمل من هون بالإنجليش. We have a very special guest, my friend and one of the best physiotherapists I've seen around the world.
My pleasure, brother.
So it's Alex.
Thank you so
Please,
much.
Alex, can you introduce yourself?
First of all, thank you for inviting me to have this time with you. I'm Alex Pineda. I'm a physiotherapy from Spain. I started almost 10 years ago my career as a physiotherapist. I started straight working in football teams. Okay, for me, sport is my passion, so I really enjoy to have this pressure through the treatment. And yeah, I stopped I came like 4 or 5 years ago to Dubai. And yeah, mainly I have been working with athletes, but at the end I treat every kind of patients, yeah, I'm focusing on sport injuries, but I also like to treat like neuropathies, neurologist patient.
Patient with like sciatica, pain radiating down the arms.
Yeah, all the neuropathies that
We call them neuropathy. Yeah.
yeah, pe- that have affection in nerve, because at the end for me it's super important to treat this structure if we have to treat like tendons, ligament, or even muscle injuries.
Mm. So, Alex, with which teams did you work previously? And
Okay, I started my career working in Cadiz. It's the team of my town, it's a team that right now is in the first division of Spain. This year we suffer a lot, but at the end we stayed in the first league.
division.
So from here I want to congratulate all the team.
Yeah.
And yeah, it was a really amazing experience, because at the end, as I told you, you have the pressure of the competition, so you have to keep the players in the top shape.
Mm.
So it's hard, but the end is challenging. So that is beautiful for us, right?
Yeah.
That's why we are physiotherapists and we treat with this kind of
With passion.
yeah.
Alex, you are one of the most updated physiotherapists I've ever met. So almost, let's say
Yeah.
that. There's
I
all
try to do
every
my
day there's
best, like everyone.
every day there's something new. I know, but like you got all the new modalities and the updated physiotherapy. So we're interested so much in this episode to talk about all the soft tissue injuries like tendons, ligaments, muscle tears, and especially for people who are doing sports, or how to go back to sports, how to deal with their injuries in a proper way. Okay, so what is the most common mistake that happens from the patient's part to have injuries and
Okay, so I think that first of all is we have two mistakes. Okay, one is comes from the patient, and one comes from us. From the patient, sometimes
from the patients? Yeah.
they don't hear their body. So maybe they are having a pain, a minimal pain, but they don't check. They think that maybe taking anti-inflammatories, resting, they can fix, and then they come back to the activity, and the problem is still there. From us is sometimes patients come to our clinic or wherever we treat them, and we don't make the proper assessment. So if we don't know what is happening in their body, how are we going to fix? So that's for me the most important mistake
Yeah,
that we
some
see.
injuries are not enough to send the patient to an MRI, and some injuries won't be cleared in an X-ray, like soft tissue
Exactly.
injuries. And so I saw you working with ultrasound, like you were checking tissues, and with you do musculoskeletal ultrasound, like.
Yeah, right.
So, what things do you find usually in people who come with common injuries like tennis elbow, shoulders, shoulder pain?
Okay, so same as before, I can tell you some patients they wait a lot, So once they arrive to the clinic, I see that the evolution of the injuries is already advanced.
Mm.
So imagine we can see a reactive tendinopathy. The meaning of that is it's just inflammation of the tendon. and the patient waits, and then we see that we have gaps. So gaps means that we have tears inside the tendon. Why that happen? Because the patient wait a lot to see a therapist, and then the damage is already done in the tissue. For
Some patients try to take anti-inflammatory at the beginning if they see like they went to the gym, they feel a pain, so it stayed for 3 days. Commonly, they take anti-inflammatory, and
yeah,
they keep on training. So, what do you think about that?
I mean, as a short-term effect, can be okay. Sometimes we, we reduce the pain just taking a pill and we say, halas, it's fine. But it's not, because the problem is still there. So I, if they have pain, I don't mind if they want to take something, but at the end, it's not the solution. And something that I also saw on the clinic here, even in Spain, everywhere, a patient come with a big injury and we don't know what is happening. You were talking about the ultrasound, and I'm gonna tell you one story that happened many times to me. The patient came and they went to another places, and they didn't make the proper assessment. They didn't know what to do, what was happening there. So what they did, straight they start to put needle, massage, or that. But there is an injury in the tissue. They have a tear, for example. So imagine that you have a tear, and then you start to touch the tear, or you
You
have
do massage and you put a
massage.
needle in a place where there's a muscle tear.
Has no sense. At the end, it's going to affect more to the tissue. So I saw patients that they did that, and then they came to me, and I saw the bleeding, the edema was huge. I asked them, "What you did?" They told me, "No, I had a injured and I went to somewhere and they did that," because I asked which kind of treatment they did. And when
When
they
you look into the muscle,
when you go inside and you see what was happening, it has no sense to do this kind of treatment. First, sometimes
if it's a 1 centimeter tear that would heal in a week, it would become a 3 centimeter tear that would heal in
maybe you don't open more, but at the end you don't let the tear
double
heal.
the time.
Exactly. So, but sometimes the tear is gonna take between 20 days, 25 days. Can be shorter time, but at the end, the injury has the period to fix.
Any injury that happens to the soft tissue,
Yeah.
let's say muscles, and then we'll move into tendons.
Okay.
But any minor injury, for example, someone who was doing gym and felt did a muscle tear, know, might have lifted a little bit hard and had a muscle tear.
Okay.
How much time? When should he come back into training?
Okay.
And when should he start loading the tissues?
Okay. So first of all, we have to hear the body, and if we have the tools to assess well the tissue, so we have two things that we can use. One is the pain of the patient, and the other one is the assessment of the tear. Sometimes the tear can be still not healed, but we can start to have activity.
To load the muscle.
To load the muscle, exactly. So we're gonna play with that. Okay, the tear is still there. The patient has not much pain, so we're gonna start with low load. If the patient can handle this, we increase. Okay, we don't go straight to do like a big loads like that. So we play hearing the patients, how is the pain, how is the tear, and of course, if the tear is not completely healed, we don't go to full load. We start to build up since the first steps. We even if we have a tear and it's not completely healed, we cannot give full load. Why? Because we can have a damage. It can come. So I think that we have to play with that.
Let's define injuries for people to understand more and guide them more in a better way. So let's say there are minor injuries,
Okay.
medium injuries, and severe injuries. Where let's not reaching severe injuries, we won't call it like we won't specify full tears, okay, but partial tears.
Okay.
So if we're talking about minor injuries, like maybe some swelling in the tendon, overloaded, wrong movement in the gym, something that is minor, what protocol you would suggest for the patients to do, and how much time would take them to recover? And in each stage, we ask the same question, like in each level of injury, what protocol would you suggest?
Okay, so first of all, it's super important the load control. So
how much weight to lift?
Exactly. Imagine that the tendon is going to be affected because two causes. We can have an overload.
Two reasons, yeah.
Two reasons, exactly. And overload, sometimes they don't have load. There are patients that they are not active. So even the overactivity and the no activity is going to affect to the tendon. So we have to be clear with that. If a patient come to us with an injury, any injury, and they don't have any activity, we have to make them active. We have to start to build up this activity. Why? Because our body makes to have movement.
Yeah.
And the same with patients that every day they are runners, they are weightlifter, and they are every day doing sports.
Are active people.
Sometimes if they have an injury, they cannot keep doing the same activity. I'm not gonna tell them. We are not gonna tell them stop your activity, but reduce the activity just to balance.
Just to be training without pain.
Exactly. Yeah. We can. I mean, we can manage. We can tolerate.
Would you consider resting, full resting, as a solution?
No, I never use this. I never said to my patient.
Not even for strong injuries.
I mean, if they have a fracture or they have
something like that. No.
If they have something big, for sure. But even
keeping a movement is very important.
Sometimes minimum movements. For example, after a ACL knee surgery, we said to the patient, start to move since the first day in the bed.
At least your ankle.
At least your ankle, to improve the blood flow. It's like we have to keep the body active to improve the circulation. We have to be really focused on that. It's not good to stop and then one day, okay, I'm ready, and then you start. You can do many things. Sometimes breathing exercise. Sometimes you can start to work the other side, the unaffected side. So at the end, you work also with the brain to send signals to the affected side. So there are many ways to fix and to start working injured.
To stimulate the nervous system in the injured area.
Exactly.
And to stimulate the blood circulation at the injured area so that we can promote healing at the site of injury.
Exactly.
But we should so what you're saying, we should do that, but without overloading the tissues. Or at least if the injury is too strong, we have to do it in a very light, minimal way.
Yes.
And push it forward until it gets better.
Exactly.
Like we increase the load until it gets better. Interesting. And so when if somebody feels something, a pain in their knee doing squats, and a pain in the shoulder doing shoulder press, so when is the best time to go see a physiotherapist, especially a sports physiotherapist who deals with sports injuries? Would you suggest at the point of pain, or would you suggest they decrease the load and try to increase the load and then see a physiotherapist? What do you think is the best way of thinking?
Okay, the thing is that sometimes the patients or the athletes, they think on us just when they have the problem. So for me, it's super important also the maintenance. They come to the clinic and just for ask us, okay, I'm gonna change the load, I'm changing the activity, and we can guide them to have a correct change of activity. So I think that we have to guide them not just when they have the injury, also when when they want to start to be more active, or so we have to guide them since the beginning, and they can come to us not just to heal,
to prevent. What about old injuries? Like if a patient had a shoulder pain that took 3 months to heal, they went back to training, they are doing fine. What things would you look for, or how important is it for you to look at that injury during the preventive sessions?
Okay, there are two things that I want to talk about that. One thing, is about the injury. We can heal the injury, and also the other thing is the cause. What produced this injury. So, for example, it's super important the motor control. What is the motor control? Is the
motor control talking about stability of
exactly.
Just making it more simple for people.
Yes.
It's the control of the joints that
the stability.
using all the muscles that should be working at during the movement of a joint. Yeah.
So if the muscles that working
Surround the joint.
around the joint are not working well, so imagine if we have the chest working more than the
Back.
rhomboids muscle, you know, at the end we're gonna have a protrusion. Protrusion means that the shoulder is gonna go forward. So if the stability, if the position of the joints are not right, for sure, if we have overactivity, we're gonna have a damage. So that's why I was saying that okay, they can come to us and we can check, okay, how is working the structure, and then we can tell, okay, you should be focused working more in the back muscle to have more activity, better activity, to have more balance, and then we are gonna prevent danger. It's like it's not just sometimes fix the injury, sometimes it's the prevention of the injuries. That's for us is super important. You know, we prefer to prevent than heal.
yeah, of course. But talking about if I want to go back to old injuries, like how would you look at them? How would you strengthen an old injury? For example, someone who had the injury for like 3 months, got out of it, doing well. How would they maintain a good exercise and a good shoulder for the next 3-4 years?
Okay, so the first thing is remove the pain. Imagine the pain.
No, they are out of the pain.
Okay, they don't have pain anymore.
So I'll repeat the question. A patient who came to you had a good treatment.
Okay.
And within 3 months, they had a pain and it was treated completely. And they went back to the gym and they started loading, everything normal. What things should they consider to this injury?
Okay, so we are gonna start to work on this injury or in this joint we are gonna start to build up. Like we are gonna forget that the patient had an injury before, so we are gonna start to build up the stability, the motor control. We are gonna start to build up since the beginning. We are gonna give load. We are not gonna think, okay, the patient is healed, they don't have problem, then we go hard and we start to give big loads. No, we're gonna start to build up step by step. It doesn't matter if they have an injury or not. Since we see the first time the patient, we are gonna start to hear, to check, to see the body, how it works, and then we build up. We don't have to go, okay, if it's an athlete that is a professional, we know that the level, the knowledge that they have about their body is high. But if it's a patient that they don't have much activity, that they go sometimes to the gym, we have to build up since the first steps.
And the techniques, because if you tell them like go, you should start doing squats, and they do a long squats, they would mess up.
I mean, it's great that they go, even if they don't know the technique, it's great that they go at least at the gym. The motivation is super important, but the technique is not the same to make a movement without control than with control. So at the end, if we make many reps,
the more the weight, the less control it is, the more the
risk is gonna be. You mean, no?
Yeah, we see that in CrossFit. We see more injuries in CrossFit because if there's any small mistake in the body, speed and weight can cause problems because of the control, motor control, the movement control.
It's funny regarding CrossFit because many people said, CrossFit is too risky, it's going to produce us too many injuries. I have a really good friend from Spain, he's an orthopedic doctor. Now he's super motivated with CrossFit. And he told me, Alex, the problem is not the CrossFit. The problem is when you go to the CrossFit session and then you go hard, you don't care about the technique. So that can produce injuries. But if you make everything with control, it's super good. You know why? Because you are lifting weight and lifting weight, and it's like it's super helpful to our body. Why? Because we have stability, we have load, and we have cardio activity. So it's like a full activity that is super helpful. But if you don't control yourself and you go to the class and then you start to compete with your friend there, then you're gonna have problem for sure.
Yeah, definitely. Alex, talking about tissues and like discs are part of our body's tissue. Yeah. So when they touch the nerve, the problem becomes a nerve issue. So how would you deal with a compressed nerve problem
Okay,
from a disc?
we have to see the cause of the nerve affection. You know, sometimes the nerve can be affected because the immune system, sometimes can be the diet, sometimes the nerve can be affected because many reasons. But in case of compressed nerves, we have to check muscles because at the end the nerve is a structure that goes through the muscle. So if the muscle is irritated and we're not having the right activity, the nerve can be affected. And at the end, the response of the nerve is going to be like the muscle. We can see inflammations in the nerve. So, and at the end, this affection can cause two things. One of them is can be affected the mobility of the muscle, can be affected the mobility of the joints because the nerve is not sending the right signals to move. But so that's, I call that like a motor issue. You know, there is a motor affection, and also the sensitive affection. So when the nerve is irritated because we have a compression, we can feel this numbness, this tingling that the patients sometimes come to us and they tell, okay, I feel numbness, I feel tingling. So that's mean that the nerve is affected. So
Some like tingling and burning sensation are
yeah,
signs of nerve problems. So sometimes we see like discs are compressed. So this is what you're saying. You see the discs are compressed and compressing the nerves, and at the same time it could
but
be coming from a muscle inflammation that's affecting the nerve
okay, regarding this, can be a peripheric affection. It's
from
peripheric,
the muscles.
exactly, that come from outside from the spine and sometimes come from central from the spine. So that's different. Okay, if we have a spine problem, if we have a herniation or protrusion, something like that, okay, we have to treat mainly the spine, the central area. Okay, we can treat also the peripheric nerve, so I mean the structure that are far from the spine, but
But you have to treat the spine.
for sure, because at the end
What
is the
what things would you suggest for patients to treat in the spine?
okay. We need to see the level of injury. Okay, if it's a really high level of injury, it's a huge protrusion. It's a hard work, takes time to heal. But if it's a small protrusion, there are many techniques like radio frequency, laser, electrolysis, a technique that you know that I use a lot. We can put some needles close to the area
And then spine,
in this not it's
around the spine.
around the spine, in the nerve that goes out in the pars. So we can apply this electrolysis. It has an anti-inflammatory effect. So we are going to reduce this inflammation, this affection that the patient has in the spine, straight from the spine. So that is going to help a lot. And also mobility, exercise. I had many patients that they came to me, to us, you know, and
Yeah.
we saw that the level of injury was so high. And they come to us, they are scared of move or to make any activity. And then the first thing that we do is try to go to their brain and tell them, okay,
Start moving.
start moving. Go ahead. Don't be scared. Well, at the beginning, it's going to be hard. But that's why we are there. Sometimes we are there just to help them to manage this pain. We play with this scale of pain, like from 0 to 10. Okay, you have from 0 to 10, you have 3 of pain. Okay, you can handle this. If goes to 5, stop. We play with this, but normally the pain is going to be there. Sometimes we are scared. We have pain, we have to stop. The pain is part of our life. Without pain, we are nothing. We cannot go forward without pain.
Yeah, we
So,
don't have the alarm system on,
exactly.
right? Like talking about pain. Sometimes when we were working at the same clinic, we used to see injuries like that are severe on the ultrasound, and the patient had minimal pain. And in other cases, the opposite, we see like patients with minimal problem and with so much pain. Like, how can you explain this for patients? Some people say like, I did an MRI, my shoulder looks so bad, but I'm training. And some patients would say, you know, I did an MRI and I can't move my hand, and the doctor said there's nothing. So
The tolerance of each patient are totally different, you know. Some patients, they don't have if we check in MRIs or ultrasound, we see that they don't have nothing, but the level of pain is so high. So, and they are the opposite patients. I'm gonna tell you one story about one football player. This guy was from Nigeria. He was playing in the club, and one day he came. He never used to come to me, but one day he came to me. I have pain, and I was scared because okay, this player never come to me, and if he comes today, it's because he has a huge problem. So we check. We went. We sent the player to make an MRI, and we saw that in the knee was destroyed. Destroyed. We saw the meniscus, ACL, everything. And I said to him, brother, you have to stop the activity. You cannot play anymore. He's telling me, what? I'm going to train tomorrow. I'm going to play this weekend. The player was totally damaged. You know, he had the knee totally damaged and he wanted to keep playing. And I have patients also that they come to me that they
Did
have.
he play that weekend?
Yeah, he played. Yeah, you know, the most funny thing he told me, you know how I fix? They have this kind of treatment. I went home, I put hot water with salt, and it's fixed. You know, imagine the tolerance of this patient, of this player, to handle the pain.
To handle a damaged knee, playing football on a
Yes.
damaged knee.
And I know people that we send them to make MRI, they have nothing. Okay, maybe they have another affection, weakness, whatever, but they cannot even walk. So the brain plays a huge part on that area, you know, in this kind of injuries.
How much to tolerate pain.
Exactly.
So how can we help manipulate the brain to feel less pain in a strong injury?
Okay, there are many ways, many techniques to help the brain to improve. How? Through the activity, through the education, through the tolerance. So we have to be there with the patient, not just when they have the injuries, also when they want to improve, they want to learn about their body, they want to know what is happening. It's like, okay, if I don't never think about my body.
This is what we're doing in the podcast.
That's really good, you know, to teach the patient, not just when they have pain. It's also about, okay, if in the case that I have pain, how I'm gonna manage it, you know?
What things, techniques you can tell the patients to do to help the brain feel less pain, like to be like the patient that the football player you were talking about, like with the damaged knee and feeling no pain. What things the patients can do at home or with the physiotherapist to be training without or to be moving or like living their life with less pain, even if there's a damage in the knee.
Okay, so first of all,
and not only the knee, in any
whatever,
joint.
any joint, we have to make the pain normal. Pain is, as I said, is part of our life. It's gonna be there. So in the moment that we know that the pain is normal, the pain is gonna be less, even if we feel pain. So, okay, we have pain. I woke up this morning, I had pain on the
Okay, let's rephrase that so that people accept it. Pain will be less once we normalize it in our lives.
Exactly. Okay. It's why? Because as I said, sometimes you wake up, maybe you were sleeping with above your shoulder, and then you wake up, what is happening? I have a lot of pain, and then you are scared. And this pain, because you're thinking too much, we are affecting one area on the brain, and this pain, instead to be one day, is gonna be 1 week. So then you think that you have an injury, then you go to the doctor, the first doctor tells you, okay, I'm gonna put corticoids. You go again
corticosteroids.
Exactly. Then you go to another doctor, the next doctor tells you, okay, you need surgery. It was just from one night that you slept above your shoulder. Maybe you know this, maybe you have a damage. It's normal, it's like a tree. I'm gonna use this example. A tree that is growing through the years, you can see that they have damage, but they are still growing. So the same in our body, when maybe we have damage, but this damage are not the reason of the pain. It's normal to have damage. A car that you use and you drive for a while, it's gonna have damage, but it's still working, right?
Yeah.
So the same as we can have damage, and
the shoulder should still, example, be moving.
Exactly. So it's important to know that, okay, it's a damage, how we're gonna.
Most of the time I tell my patients, they say like, I have a shoulder for example, inflammation in the tendon or blah 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 in the shoulder, and I'm in too much pain. When they are like, especially like people who do a lot of weights or or injuries, you know, and I tell them, like, if you do an MRI for the other shoulder, I'm sure you're gonna find maybe worse things than
For
your
sure.
painful shoulder.
For sure.
So
It's really funny, you know. There are many studies, you know, that they said that okay, if they make MRI to 100 patients, almost all of them are gonna have damages, and almost all of them are not gonna have pain.
yeah,
So why, if one has damage and at the same time they have pain, why this damage is gonna be the reason? So we have to, okay, I'm not saying that it's not important the damage that we see in the MRI or in the ultrasound.
should be fixed or not, but what you're saying is continue.
I mean, okay, we know that it's a damage, but maybe it's not the mainly reason of the pain. Okay, we have to understand, we have to check, we have to keep evaluating this damage, but not say that it's the first reason of the pain, you know? Why? Because
you have to correlate the things you see in ultrasound, MRI, X-rays to the patient.
Exactly.
And if it's not the reason why they are in pain, you should just treat the pain, not the injury.
Find a different way for treat. Also, this is for, okay, I know that this is for the patients. You are doing this podcast to the patients, but also to the physios and to the therapist. Like, we have to be careful with the information that we give to our patients. We don't have to make them feel scared. It's like sometimes I have patients that they come to me and they have a problem. I think inside, wow, we have a big work to do here. But I don't share with them, wow, you are sorry for the fucked up, and then you don't have you don't have solution. No, just keep it simple. Okay, let's try to remove a bit the pain. Don't be scared. We're gonna fix this. It's super important.
It helps a lot. I've seen it. Some patients even go into an orthopedic doctor's office and or clinic, and they say, I went out feeling better, although he just assessed, looked at the MRI, spoke to them a little bit, and you see them the next day. I've seen it several times in the clinic, and they say, you know, how did you manage the pain? Yeah, I've been in pain for 6 months, and then I went to the orthopedic doctor, and he
just read it.
he looked at the X-ray and the MRI, and he told me this and this and that, and then I left, and after a few days I started feeling better, and I'm coming now, you know. Although, like, they were taking anti-inflammatory before, and they were taking anti-inflammatory after they saw the doctor, but they feel better.
You know, the brain plays a huge area on that. You know, it's like the brain. Sometimes we just think about the structure, the muscle, the tendon, the nerve, whatever, but we forget that the brain is there. So we have to, this is something that we have to treat. I'm not saying that we are gonna treat.
If we put anesthesia and you cut the patient, you damage the body, the patient doesn't feel it. So actually what feels the pain is not the injury, it's the nerves.
Exactly, 100%. 100%.
So we always have to target the nervous system more to treat the pain. And of course we have to take care of the injury that shouldn't get worse with exercise, so that they don't get a structural damage.
Exactly. Yeah, it's an interesting thing, you know. Sometimes go out from the structure, go out from the pain, and find a different way to fix this. I think sometimes I just put the hand on the patient. I just hear the patient. How are you? How are you today? How is going on? Everything is fine. And they feel better. I think that important part of our job is love. When we hear the patient, when we spend time with them, and we said, don't worry, I'm here with you, I'm gonna help you, then helps the brain, helps the heart, helps the feeling, and then we can go forward. Why? Because the patient trusts us. It's not the same that you go with someone that you don't trust than that you go with someone that you trust. So this is the physiotherapy. This is the healthcare. We have to forget about the symptoms. We have to forget about all of this, and we have to use the love as the mainly tool that we have to heal people.
In part of the treatment, yeah.
Exactly, but it's an important part.
I think it's the most important part. I've seen a lot of patients that left a physio or a clinic because they weren't feeling comfortable and they don't feel better. And when they come to me and I check, maybe they were being treated properly, but they didn't feel well. Just a little bit of
Exactly.
treatment, they feel so much better after a small treatment, just because they were being treated maybe properly, but they were being treated in the clinic wrongly.
I don't like to say that someone is doing the wrong job, or it's not that. Sometimes it's disconnection. I think that all of us, we try to do our best to fix and to heal people. Okay, maybe you are not motivated, you don't have this energy, so the patient is gonna feel it. So at the end, all of us, we can help. All of us, we have patients that are stuck there that we cannot fix, and there are patients that we fix straight, like super fast.
Yeah,
It's depend of the lifestyle of the patient. It's depend of the trust of the patient. There are many things that can affect.
in every podcast I've had, every single person I've hosted are talking about the lifestyle, about changing the lifestyle. It's surprising. I've seen orthopedic doctors, chiropractors, physiotherapists. Everyone is saying the patient, the beginning is of the treatment is from the patient changing their lifestyle.
100%.
We cannot help them if they are still sleeping in a wrong way, if they are still doing the wrong thing for their injuries, if things should start from the diet, from every single detail.
For sure, imagine a patient that they come to us, they are gonna be there 30 minutes, 1 hour, 2 hours, whatever. The treatment is gonna be like 1 hour. They come to us and they are expecting that we are gonna fix in 1 hour, and then they come back home, they lay on the sofa, or they are on the office and they don't do nothing to fix and to change this, to solve this problem. So what are we gonna do in 1 hour? We are gonna change your life?
I had one funny story. I told the patient, you can't just keep coming to me and no, it happened like I fixed her and I told her, listen, you have to fix the way you sit, the way you sit in the office and at home, in front of the TV, how you hold your phone. You have to take care of that. And she says, as long as I have you, I'm not doing anything of that.
Okay, in that case, it's fine. He's saying something clear. Okay, if I have you here and you're gonna fix me, I don't mind. Sometimes I tell to the patient, it's a deal. Sorry.
Yeah. And the funny story. So sorry, you go.
No, I just wanted to say that it's a deal between the patient and you. It's 50% and it's a 50-50. Okay, I work, I try to do my best to heal you, but also you have to work at home. You have to
fix your stuff. Yeah. Once I had a patient who came to me, like I was going into the building of my office, and he was waiting downstairs. He didn't have an appointment. Like he was just gonna ask a question, And there were a few steps, and he told me, "Are you the doctor in the clinic?" Yeah. Well, how can I help you? He says, "I have a knee pain when I go downstairs." And I told him, "Okay, show me." And he goes downstairs and looks at me like that, and then goes upstairs and goes downstairs again and looks at me like that. He said, "I swear, like just 5 minutes ago, I had the pain." And every step going down the stairs, but now it's gone. So the pain is actually in the brain. Like, I would say sometimes and sometimes not, but there is some kind of pains, which is not a small number of patients, but it is actually in the brain. And I think you've also had this, because I've seen it with also so many of my colleagues. Like they say, when you traveled, the day you traveled, I start having the pain. They feel a little bit attached to us, and that's not a good thing.
For sure, they're gonna connect straight. They're gonna be traveling and they're gonna feel pain.
Yeah, or you tell the patient, like, funny thing, you tell the patient, "How have you been?" He says, "Since last time I saw you, I never had the pain, but today morning I woke up with the pain." It's
once you talk, it's really funny. I'm not saying, I don't like to say to my patients, okay, the problem is in your brain.
You can't say that. We're saying that on a podcast.
I'm not telling them that they have a brain problem, but at the end, what I want to say is that we have to learn how to manage the pain, how to listen our body and say, okay, it's not a big problem. Okay. I'm healthy. I'm eating well. I can walk. I can do everything. I have a bit of pain. I'm going to manage my pain.
And it's gonna go away.
Exactly. It's gonna I'm gonna work to make it disappear.
The mindset. You're saying the mindset.
Exactly. 100%.
So I think this is what you added on every other podcast over any other podcast, that everyone was talking about the lifestyle, about changing eating, treatments. Everyone had a certain way of talking about treatments, but something you added is the mindset. And we have to try to implement it into the patients, that they have to have a proper mindset to get out of the feeling of the pain that is actually 100%. In the brain.
Something that they have to, because at the end we spend, as I said, 1 hour with the patient, and they stayed with themselves the rest of the
23 hours.
Exactly. So they can do something at home. They can remove this fear of the pain, and then it's gonna be easier to heal. Okay, it's like there are many ways to heal an injury, but I think that the 60-70% depend on themselves. And try to okay, I'm gonna be relaxed, I'm gonna fix this because I know that I'm gonna fix this, and that's it. I think that's the best way to help them, you know.
Yeah. Alex, do you have any funny story that happened with you during your career?
Yeah, one time I remember one old lady, you know. This is a really funny story.
Yeah.
For me, for sure, you know. This lady went to an orthopedic doctor, you know, and the doctor told her that she has like in Spanish we said pico del oro. It's like the parrot
peak.
Peak, exactly. So it's an injury that osteophytes on the spine, you know. And she came to me like after 1 month, and she came to the room, you know, to the console. We thought move the neck. I was scared, you know, what is going on with this girl. And then I asked her, okay, why you don't move your back? Why you don't move your neck? And she told me, because the doctor told me that I have a parrot peak, so I am scared that the parrot, you know, attack my neck. You know, I say, how is possible? Look at how important is the information that we give to our patient. What's that old lady?
She thought the osteophytes
exactly
is gonna hit the nerves and the...
But she was in her brain. She was thinking about a parrot and the peak of the parrot attacking the neck. You know, she doesn't understand about the. She didn't understand about the osteophytes.
Yeah.
So it's super important information.
Just simplify the problem. Don't make them pass the limit of the injury. Like do something that would injure them more. And just simplify the problem. Yeah.
You know, and also super important that I was talking with one of my friends, he's an orthopedic doctor in Marbella. We were talking like last week, the stress affect to our body. The stress produce injuries. So we have to remove this stress of our life. We have to slow down, breathe, and go forward. Because if we have a stress, we are going to have maybe today pain on the shoulder, tomorrow on the hip, day after on the lower back. The stress is a
major thing.
Yeah. This is something that I see. The patient come to our clinic, I have 1 hour treatment, I have too much pain, I need to fix because tomorrow I have to travel or whatever. And we have to remove this stress. You know, this is something that...
turn them off. Yeah. Shut them down a little bit.
I think that we see it on the clinic, right? When people is in a rush because they have just 30 minutes and they have to do treatment. And if in the first session they don't get result, they are upset.
Chill.
Life is to chill, you know, to enjoy it. You go. That's why it's important, the connection with your therapist.
Yeah.
The therapists have to be humble, have to be clear, have to be friendly with the patient. It's honest. Exactly. It's like they are not customer. They don't come just to pay. They come because they need help. So let's sit, let's hear. Even let's be honest, if we cannot help, we're gonna tell them, okay, I don't know what can I do, but I'm gonna be with you in the process. If I cannot fix, I will go to my friend that he's a really good professional. He's gonna help you. And you go with them. If they cannot, okay, we are gonna be with you, and the team is growing, and it's people that he really
people taking care of you.
Exactly.
Are the number of people taking care of you is bigger now.
Exactly.
Yeah. Alex, it was a nice session. I
Thank you
liked
so
it so
much.
much. We cleared up a lot of things for patients, how to think, how to take care of their injuries, especially soft tissue injuries like tendons, ligaments, and muscles, muscle tears. We didn't go into much details, but definitely we will do another session for certain cases. Okay, later on.
Sure.
We can talk about like muscle tears, or like specifically in a certain area, or tendonitis in knees, ankles, shoulders.
Anytime.
Yeah.
I was thinking to come and talk about different techniques and explain, but this is not the.
It's too much for the patients to understand a lot about techniques. Maybe we can do one podcast
Anytime.
about, for example, which this machine is good for this good machine is good for this. So we can see about that.
Sure.
Alex, it was very
Sami,
nice having
thank you so much for inviting me.
You're welcome. You're welcome, man.
Pleasure,
You're
as
welcome.
always.
Thank you.